Hi everyone, Danielle here from Putnam Record Agency. What you may or may not already know is that Doug Mahaney and myself also sell Medicare insurance plans. Over the past 9 years of selling Medicare insurance, I've come to find that while a lot of people have it, not too many people understand what it covers and how much it costs. So what I decided to do is a 3-part mini-series to talk about Medicare. In this first part, I'm going to talk about Medicare insurance basics. What is Medicare? Who qualifies for it? And how much does it cost? In the second part, I'm going to talk about Medicare Advantage plans. What are Medicare Advantage plans? Are all plans created equal? You'll find out. And finally, in the third part, I'm going to talk about Medicare supplements and standalone prescription drug plans. Can you have a Medicare supplement and a Medicare Advantage plan at the same time? Stay tuned. Thank you so much for joining me on this journey. I hope you learn a thing or two. Now let's get started. So what is Medicare? Well, Medicare is our government's healthcare program for seniors that are 65 years and older. There are also people that are under 65 that may qualify for Medicare due to a disability. Typically, if you're receiving Social Security benefits before turning 65, then they will automatically send you your Medicare card approximately 3 months before your birthday. Your Medicare Parts A and B will become effective the first of the month that you're turning 65. If you are not receiving Social Security benefits, then you should go to ssa.gov or contact your local Social Security office to schedule an appointment and get enrolled in your Medicare Parts A and B. I would suggest the sooner the better, just because it does take some time to get things done and get enrolled. And you want to make sure you have your cards before you're turning 65. All right, so what is Medicare? Well, Medicare Part A covers hospitalization, skilled nursing facilities, and hospice. Typically, there's no cost for Medicare Part A, as long as you've worked 10 years or 40 quarters and have been paying into Medicare. If you didn't work the 10 years or have the 40 quarters in, then there could be a cost upwards of $422 a month for Medicare Part A. With Medicare Part A with the hospitalization, there is a $1,340 deductible per benefit period. So what does that mean? Well, if you're in the hospital as an inpatient, whether you're in there one night or several nights, the portion you're going to be responsible for is that $1,340. For the skilled nursing facility, the first 20 days are covered by Medicare, so you would not assume any cost. Now, in order for Medicare to cover it, though, you need to be in the hospital 3 days and then be released into the skilled nursing facility for rehabilitation. So if Medicare covers the first 20 days, what happens to the rest of the days? Well, your copay for each day is $167.50 for days 21 through 100. Medicare will only cover 100 days, so after 100 days, if you're still in that skilled nursing facility, then you assume all the costs. For Medicare Part B, there is typically a monthly premium of $134. If your income is higher, that cost could be higher. Likewise, if your income is lower, that cost could be lower. Now, if you're already receiving the Social Security benefits, they'll take your monthly premium right outside of your Social Security check. If you're not receiving benefits, then you'll receive a quarterly statement and you can pay via mail. So what does Part B cover? Well, it actually covers a lot of things. It covers your doctor's visits, specialist visits, durable medical equipment, diagnostic testing, lab work, outpatient surgery. And with Medicare Part B, there is an annual deductible of $183. So whether you're going to the doctors in the beginning of the year or having a diagnostic test done, you're responsible for the first $183. After that deductible has been met, Medicare typically pays 80% and you'll be responsible for 20%. So when you receive a statement from your doctors or your facility that you've gone to, the first column is typically what the facility or the doctor charges. The middle column is the Medicare allowable amount following the Medicare schedule. And finally, in the last column, it would be showing you the 20% that you're responsible for. So it's the 20% of the lower amount typically because it's the Medicare scheduled amount. Now with Medicare, there is no maximum annual out-of-pocket. So if you have a lot of medical visits to the doctors, a lot of procedures, your cost is going to continue to accrue for the year. And that's why we're going to get talking about Medicare supplements and Medicare Advantage plans. I hope you learned a thing or two today. And as I didn't talk anything about drug plans, that's because Medicare does not provide prescription drugs. Prescription drug plans are offered through private insurance companies. So when I talk about the Medicare supplements, I'll delve into the prescription drug plans too. Thank you so much, and I hope you join me tomorrow to talk about Medicare Advantage plans.